Evening. Thanks for being here. I'm Nina Sperano.
And I'm John Erickson. Today, health officials reported that a person who tested positive for monkeypox visited Oconto County, saying the person was contagious, but the exposure is isolated and the person doesn't live in Wisconsin.
So should people be worried about catching this virus, and what else should they know? NBC 26's Tyler Jobe explains.
The new monkeypox outbreak began just last month. More than 1,300 people globally, including 45 here in the U.S., have contracted it. But a Bellin Health infectious disease expert says, despite this case, people should not panic.
I would reassure people that they don't need to be worried that, monkeypox is going to be this huge pandemic.
Dr. Michael Landrum says that's because it's not as contagious as COVID-19. You're exposed to it by being in very close contact with someone who is infected. In some cases, he says it could take several hours to be exposed.
It's a different virus. It requires longer contact.
Wisconsin does not have any confirmed cases of monkeypox right now.
The main natural place where monkeypox hangs out is in rodents, and then humans and monkeys are kind of secondary.
But UW Health Infection Prevention Medical Director Dan Shirley says the Badger State did have an outbreak before in 2003. According to the CDC, more than half of the 71 total cases that year were in Wisconsin.
No one got really sick, which is the majority of the cases of monkeypox.
Landrum says it can be deadly, particularly for those with chronic health problems.
No one in the current outbreak, as far as I'm aware, in the United States has died from monkeypox.
Symptoms include a fever, fatigue, coughing, and swollen lymph nodes. Experts say you should really keep an eye on a rash that develops into blisters.
And that is what is unique about monkeypox. It is the way that the rash looks.
Landrum says he doesn't know how this current outbreak started, but adds it is more common in gay and bisexual men. Reporting in Green Bay, Tyler Jobe, NBC 26.
It can take up to 3 weeks to see symptoms of monkeypox. We're told an infection can last up to a month.
Well, experts say the smallpox vaccine can protect people from getting monkeypox.